National Hospital in Nairobi are celebrating a medical milestone in their career after a multidisciplinary team of medical specialists led by Dr. Naomi Gashara, a pediatric cardiologist, successfully carried out a 4-hour highly delicate surgery on a 2-year-old baby, Curson Mickey. The baby Curson was diagnosed with tetralogy of Fallot at birth in 2018, caused by a combination of 4 heart defects that are present at birth and admitted in early January. The surgery was later successful after 3 months. Our reporter Dolly Murigi was at the Kenyatta National Hospital and filed for us the following report.
It was not an easy journey for Curson, but I want to thank all the Kenyatta doctors.
A story of resilience, helping change the trajectory of health for humanity is a lofty goal, and it's one that Kenyatta National Hospital is deeply devoted to. On Monday, a group of medical specialists from KNH celebrated a milestone of successfully carrying out a delicate surgery on a 2-year-old boy. Baby Curson Mickey was born in 2018 with a rare condition caused by a combination of 4 heart defects that are present at birth, which limits blood flow out of the heart and into the rest of the body. 2 weeks after the diagnosis, doctors from the Mama Lucy Kibaki Hospital referred baby Curson to KNH for specialized treatment. He was admitted on January 10, 2022, with the surgery being conducted on the 18th of January this year.
Curson is not the first case we are doing of tetralogy. We've done many, but this was a particular case because he complicated and he's been to theater several times, like 5, but he has pulled through. But that's why we are here to celebrate him, because if it were not for the multidisciplinary team, we'd probably be talking about a different language.
He was born where the heart is not well formed as a whole, and it's a complicated process where not only is there a hole, but there are other challenges with how the heart is, and therefore the heart is not able to pump blood effectively to the lungs to get oxygen. And this is what we went in to repair. 1, to close the hole, and number 2, to create an effective pathway for the blood to flow into the lungs.
Curson's mother was emotional, could not hide her joy as she explained the painful joy towards her son's healing.
Until being told that she would go home with her child having an oxygen. But now, we'll be going home with Curson without an oxygen.
Unfortunately, young Curson developed complications right after the operation, such as pneumonia, lung complications and kidney failure, which necessitated a multidisciplinary team of specialists that included medical personnel specially trained to look after every sick patient round the clock.
Curson, in the type of complications he had, he actually, basically the only place which he never had any trouble with is his brain, and that's what helped him. He had infections in the chest, he had renal failure, some stage I think the liver had some few issues, but he was able to pull through. And the reason why he pulled through is the participation and the availability of all the specialists who were needed at the time when they were needed.
As such, there are several patients on the waiting list since KNH attends to 3 to 4 patients per week against the reported cases in need of specialized surgery.
And there are many others who sometimes do not get to be diagnosed early enough. Curson is lucky because he was born within Nairobi and he was able to get easy access to care. There are many other children in the country who are born in far-off places where they may not have the same level of care available to them immediately. So some of them we get to see when they are much older.
In such cases of Curson, it limits the number of surgeries since it requires quite involving care 24/7 and a long duration of time in post-operative care.
What I can tell them is to have faith and to bring their children to the hospital, because there is a way that they can get some help or to be assisted, rather than just having a kid in your house and you feel like this kid will never be well. You hide the baby, you feel like the baby will never get healed. There are doctors who can assist them.
As a parent, at times you feel low when the boy is in critical condition, but at that point there's nothing you can do. The only thing is to trust God and to pray so that the boy can be well. So I thank God and I thank the management who have made it up to this far.
They say there's light at the end of the tunnel, which is the case here for a delicate and complicated repair surgery, which turned out successful for baby Curson. Dolly Mirigi, Hope TV from Kenyatta National Hospital, Nairobi.